in New Brunswick. Bon après-midi tout le monde et bienvenue.
Good afternoon, everyone, and welcome to this COVID-19 situation in New Brunswick. Spokesperson for this is the Dr. Jennifer Russell, Chief Medical Officer of Health, and Honorable Dorothy Shepherd, Minister of Health.
Province this afternoon. Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous.
Good afternoon, everyone.
La quatrième vague de la pandémie.
The fourth wave of the pandemic is hitting our province very hard. We are seeing a surge in new infections to levels that we have not experienced at any point since the pandemic began.
The COVID-19 pandemic is hitting our province very hard. We are seeing a surge in new infections to levels that we have not experienced at any point since the pandemic began. This is likely to continue for some time. The public health measures now in place will slow the pace of infection, but given the incubation period for this virus, we will not see the results of these actions for a week or so. The COVID-19 virus can infect anyone that comes into contact with, whether or not they have been vaccinated. And this is clearly shown in our most recent case counts. However, our focus now is on the infections that develop into more serious illness and the ones that lead to hospitalizations and deaths. Les preuves sont claires. Si vous n'êtes pas vacciné,
the proof is clear. If you're not vaccinated, you are 16 times more likely to become severely ill if you contract the COVID-19 virus. I want every New Brunswicker to be safe and to stay healthy. But there are now and will continue to be breakthrough cases of COVID-19 among people who have been fully vaccinated.
If you are unvaccinated, you are 18 times more likely to become severely ill if you contract the COVID-19 virus. I want every New Brunswicker to be safe and stay healthy. But there are now and will continue to be breakthrough cases of COVID-19 among people who have been fully vaccinated. Aujourd'hui, Santé publique.
Today, there are 119 new cases of COVID-19 in New Brunswick. Among these, 32, that is 29%, have received 2 doses of a vaccine against COVID. I'd like to explain to you why this is happening, what it means, and what you can do to keep yourselves and your families safe.
109 new cases of COVID-19 in New Brunswick, and of these, 32, or 29%, had been fully vaccinated with 2 doses of a COVID-19 vaccine. And I'd like to take some time today to talk briefly about why this is happening, what it means, and what you can do to keep yourselves and your families safe. The COVID-19 vaccines are very effective, but they're not perfect. And while you are less likely to be infected when you are fully vaccinated, it can happen. The evidence to date shows that they are very good at preventing serious illness, hospitalization, and death among those infected with COVID-19 virus. When you are vaccinated, you develop antibodies that will help fight off the virus. And if you become infected, you may not have any signs of illness, or you may experience relatively mild symptoms from which you are able to recover within a week or 2.
People that are most exposed to dangers at the present time are those who have no vaccinations or who are only partially vaccinated. Among the 63 people hospitalized due to COVID-19, that is 76% or 48 people have not received a complete vaccination. Among the 27 people who are found in intensive care units, 22, that is 82%, have received no vaccination.
To those who are partially vaccinated or not vaccinated at all. Of the 63 New Brunswickers now in hospital with COVID-19, 48 of them, or 76%, have not been fully vaccinated. There are 27 New Brunswickers currently in an ICU bed because of this virus. 22, or 82%, are unvaccinated. Since August 1st, our rate of ICU admission for unvaccinated patients is 33.4 cases for every 100,000 unvaccinated New Brunswickers. Now, if we contrast that with the rate for fully vaccinated, it is just 1.8 cases per 100,000 fully vaccinated New Brunswick residents. And this clearly shows that vaccines are doing the job of preventing severe illness from COVID-19. And I just want to thank the staff who provided those numbers and the breakdown to help frame this information for all of you to be able to hear it and understand it. If you are not yet fully vaccinated, my message to you is to get vaccinated as soon as you can. More than 81% of our population is now fully vaccinated, and 90% have had at least one dose. I'm particularly pleased to see that the number of people getting first doses is rising again, and this shows that our measures to encourage vaccination are having the desired effect. But that still leaves 128,000 eligible New Brunswickers who are not yet fully protected against the virus, and 69,000 who have not yet been vaccinated at all. So I am concerned about those numbers. I am concerned about those people as individuals, and I'm concerned for their families who might be worried about them as well not being vaccinated. De plus,
Moreover, there are tens of thousands of children under 12 years of age who are not eligible for vaccinations yet. We're impatiently awaiting the approval of Health Canada to start vaccinating these younger children. Even if the children don't tend to get as sick as adults and are less likely to require hospitalization, they can transmit the disease to others.
thousands of children under 12 who are not yet eligible to be vaccinated against COVID-19. We are eagerly awaiting the approval from Health Canada to start rolling out vaccinations to the younger age group. While younger people don't tend to get as sick as adults and are less likely to require hospitalization, they can transmit the disease to others. Therefore, the more we can protect them, the more we protect everyone. For those who are vaccinated, your protection is greater, but not complete. The vaccine is just one layer of protection. You must continue to follow all the other public health guidance and advice to keep yourselves and everyone around you healthy and safe. While you may not become seriously ill from COVID-19, you may pass on the virus to others who are not so well protected. You may unwittingly infect a family member whose immune system has been weakened by disease or old age. You may infect someone who is not yet able to be vaccinated, such as a child under the age of 12. This is why everyone must continue to watch for symptoms of COVID-19 in themselves and their families and stay away from work or school when you feel unwell and get tested if you have symptoms, even mild ones. I also strongly recommend that everyone be vaccinated against influenza this fall. Vaccinations are available now from doctors, pharmacists, or through your workplace. L'an dernier, il n'y a presque
Last year, there was almost no flu cases through the measures in public health, while I'm afraid that the flu is going to return this summer. Being infected by the flu and COVID-19 at the same time could severely impact your health. The best protection you can have is to be fully vaccinated against both viruses. We can learn to live with COVID-19.
non-existent last year, thanks to public health measures put in place because of COVID-19, I am concerned that it will make a comeback this winter. In fact, I was looking at the numbers from the 2017-2018 flu season, and I believe in that year we had about 600 people hospitalized because of because of the flu, and we had 50 deaths because of the flu that year. So, being infected by the flu obviously carries risks of hospitalization and death, but having the flu and COVID-19 at the same time could severely impact your health. The best protection you can have is to be fully vaccinated against both viruses. We can learn to live with COVID-19, and we can protect our most vulnerable New Brunswickers, and we can keep our healthcare system from becoming overwhelmed. We can do this if we all work together. Follow public health advice and be kind to one another. We can do it because we have done it before, and the evidence on this is very clear. Thank you very much.
Good afternoon. Bonjour. Over the Thanksgiving weekend, all New Brunswickers were asked to make a significant sacrifice. We all had to avoid public gatherings and could only spend time with our single household bubble to help reduce the spread of COVID-19. I know the majority of people followed those rules, and I want to thank you for doing your part to get us back on the right track. We have asked a lot of you, and I appreciate the work you have done to protect your fellow New Brunswickers. Between Friday night through Monday, officers and inspectors responded to 28 calls for service and conducted more than 600 inspections of stores, restaurants, licensed establishments, events, entertainment and fitness venues, and several private dwellings. I'm pleased to report that nearly everyone was found to be in compliance with the rules. 10 self-isolation orders were issued to people who arrived at the New Brunswick border without proof of vaccination, and 1 compliance order was issued in Moncton. In connection with care required when checking proof of vaccination at a venue where vaccination proof is required. As part of these inspections, peace officers visited 63 places of worship to ensure they were following the rules. I was pleased to learn that 62 of the 63 locations that were inspected were in full compliance of the rules. Non-compliance was found at only 1 location, His Tabernacle Family Church on Rockland Road in St. John. Investigations are ongoing and matters are before the courts. I am deeply appreciative that nearly every religious leader and faith community in New Brunswick is doing the right thing by keeping their community and their province safe. They are requiring proof of vaccination or having smaller, distanced mass gatherings, or they are taking their celebrations online temporarily. These are tough decisions, but necessary ones, and I appreciate the leadership that is being shown. We all know that our province continues to face a very serious situation. Hospitals across the province are feeling this strain. Last week, Horizon and Vitalite Health Networks announced that all hospitals and healthcare facilities will return to red level protocols beginning today for Vitalite and tomorrow for Horizon. These measures are being introduced in part to address the strain that has been placed on healthcare workers. These measures are already in place at the Campbellton Regional Hospital due to an in-hospital outbreak. And already, visitors are not permitted in hospitals in either health network. For Horizon facilities, these measures will be in place for at least 2 weeks and will mean that some non-urgent medical procedures and elective surgeries may be postponed, and non-urgent ambulatory outpatient clinics and professional service outpatient appointments may be postponed. All patients, clients, and support persons will continue to be screened for COVID-19 symptoms. Patients are asked to seek alternative options for non-urgent healthcare needs rather than presenting at an emergency department or urgent care center. At Vitalite facilities, all non-essential services will be reduced or temporarily suspended, including ambulatory care services, professional services such as physiotherapy, occupational therapy, and nutrition, non-urgent medical imaging services, and elective surgeries. Patients who are affected by these measures will be contacted directly. If you are not contacted, you should attend your scheduled appointment. In addition, Extramural Ambulance New Brunswick is moving to the red level of alert to help maintain essential services and ensure services are redeployed as needed. We will be assisting the regional health authorities as needed over the next few weeks as we work to reduce hospitalization and ICU admissions. For now, I am pleased to hear that nearly all hospitals continue to have capacity available to provide essential services. I know this impact on routine health services is very frustrating for those who have had an appointment or surgery postponed, and your frustration is completely understandable. I would like to emphasize that the health networks are taking these steps because they are necessary to get the situation under control as quickly as possible. I want to thank Horizon and Vitalite Health Networks for the commendable levels of cooperation they have shown under these challenging circumstances, including sharing resources as needed. And EM, A, and B as well have really come to the table. And I want to commend all of the CEOs of these entities for working together to provide the best care that we can to New Brunswickers. Horizon recently, as of Friday, sent nurses to Campbellton to help offset their shortage of human health resources while they're undergoing their red level alert. I am hopeful that with the regulations currently in place, hospitalizations will begin to decline very soon, and these measures will not be necessary for long. I also want to thank all of the frontline healthcare workers, especially nurses, who have been especially impacted by this strain on our healthcare system. I know that you are working long hours and dealing with incredibly stressful situations. I truly appreciate the work you are doing to help all of New Brunswick. The Delta variant during the fourth wave of the pandemic has hit our province much harder than previous waves. We are all feeling this impact. The high case count and the high numbers of hospitalizations we have experienced in recent weeks has led to new measures coming into effect. A circuit breaker has been in place since Friday in several areas and will last 14 days. As a reminder, the impacted areas include Zone 1 as far north as and including Saint-Anne-de-Kent and including Havelock in Zone 2. The northern portion of Zone 3 from and including Deerville and Florenceville-Bristol, and all of Zone 4, including Meneville, in Zone 5. A full list of all impacted communities can be found on the GNB coronavirus website. All New Brunswickers will be impacted by some restrictions, such as wearing a mask in indoor public spaces for the foreseeable future. These are the steps that are necessary to find a balance between living our lives as normally as possible while reducing the impact on our healthcare system. We are also exploring other ways to prevent the virus from spreading, such as expanding our use of rapid testing. These tests have already been made available to businesses through chambers of commerce. And starting today, rapid tests will be made available to unvaccinated students who have been identified as a close contact of a positive case to help reduce the time they need to self-isolate and minimize disruptions to learning. The COVID-19 pandemic is still evolving, and as always, we are continuing to evolve with it. I appreciate everyone's continued patience and cooperation as we face this latest challenge. By doing our part and by taking care of one another, I know we will make it through this fourth wave. Thank you. Merci.
Dr. Russell, merci beaucoup, Minister Shepherd.
Thank you, Mr. Shepherd and Dr. Russell. We'll now proceed to questions from the reporters, the media. You have the right to ask your questions in the language of your choice. Each reporter will have one question and one follow-up question, a very quick follow-up.
Questions with members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. On va commencer. Frédéric
Camarano, Radio-Canada. So, good afternoon. My question is for Dr. Ruffel, Chief Medical Officer of Health. And if there's rapid tests in the schools, that the steps to follow are a bit vague. So I'd like you to explain to us step by step what happens once you confirm a case in a school for rapid testing. The details for the tests and how they work, it was provided to the parents and to school administrators and teachers, I believe, all are online so that people can be able to read all the information. But just to check if I had any details in front of me, because it really is a new process. I have it. Okay, I found it. Good. So the goal of the program is really to be able to have students at the school as much as possible during either the outbreaks or when people are in close contact with cases. So the Department of Education collaborated with the Department of Public Health for this program. And at the present time, it's really today, students who are not vaccinated or who are identified as a close contact of a confirmed case, they're going to be provided with the 5 to 15 days of rapid testing. And this depends on the date of exposure to the confirmed case. And like I mentioned, all the instructions and the details are all given to parents, and the tests can be sent home with the students, or they can be brought in by the parents on the next day, depending on when the school had given the indication that the student was a close contact of a confirmed case. And students who are unvaccinated are going to be directed to self-isolate for 24 hours while they're taking their first or two rapid tests. And that is the case, except if public health gives other directions or guidelines. Public health is going to say if yes or no, the students are going to be able to go back to school after they have had their 2 negative tests, and if they have no symptoms. So they will have to continue to have tests every day up until the end of the period prescribed by public health, with the instructions and guidelines they received with the tests themselves, to continue to be able to go back to school. And students and employees of the school, if they're vaccinated or not, there's no difference. They will have to stay home, and they should have a PCR test, so not the rapid test. And that's going to be done through public health. And if they received direction that as a close contact, and even if they only have one symptom. So I'm going to repeat that in English because I know that some people are listening would like to have all the information in English as well.
Testing program is underway in schools, and the Department of Education and Early Childhood Development collaborated with Public Health to develop this new rapid testing program for schools to help minimize disruptions to learning due to COVID-19 outbreaks. So beginning today, unvaccinated students who are identified as a close contact of a confirmed case will be provided with a 5 to 15-day supply of rapid tests, depending on the last possible exposure date to the confirmed case, along with instructions. So the tests may be sent home with the students or picked up by parents the following day, depending on when the school is notified of the confirmed case. And so unvaccinated students will be required to self-isolate for a period of at least 24 hours while they take their first 2 rapid tests. Unless they're otherwise directed by public health, those students will be able to return to school once they have recorded 2 negative tests and if they have no symptoms. They will be required to continue to test daily until the end of the period as prescribed by public health through instructions that they will receive with the kits to continue to attend school. Students and staff, regardless of vaccination status, must stay home and get a PCR test through public health if they have received notification that they are a close contact and have even one symptom.
Beaucoup. Monsieur Camarano, as-tu un suivi?
Mr. Camaro, any follow-up? Yes. I'd like to know if all the schools are ready and if those tests are ready for all the schools. The information that I have at the present time is that all the tests are being distributed at the present time. So I believe that it means that there are going to be some schools that could not start today, but as soon as possible, they're going to start. Thank you, Mr. Camaro. Maya, Radio Canada. Maya? Yes, good afternoon. Can you hear me? Yes. My question deals with pregnant women. Do we see some that are hospitalized or in intensive care in the past few weeks. Do we have any figures on those? So I have no information on present numbers here in New Brunswick, but I can tell you that the risks are very high in pregnant women. And there are other places here in Canada where ladies who are pregnant, who are not vaccinated, and who had COVID-19, and they had serious symptoms, and it really needed them to be admitted to ICU or at the hospital. Some women as well deceased before they gave birth. So it's really important that women who are pregnant be vaccinated as quickly as possible. Maya, do you have a follow-up question? Sorry, my connection cut off. Yeah. Do you have a quick follow-up question? Yes. The connection cut off, so just for me, but I didn't hear the end of the answer. So not a question, but so we don't not know if they're pregnant women who are hospitalized or were hospitalized in the last few weeks. Dr. Russell? I have no information on the number of pregnant women who were hospitalized, but I can only tell you that the risk is very high amongst women who are not vaccinated and were pregnant. Thank you. Thank you. Justin Dupuis, Acadie Nouvelle. Yes, my question is for Mrs. Russell. I'd like to know, for the past month, we've seen that the number of fully vaccinated people who were infected by COVID has increased greatly in New Brunswick. And I'd like to find out if you know why. Do you believe that it's because of the decrease of protection against infection conferred by vaccines? Is it for that reason? Because it is something that was observed elsewhere. So I don't know if you have any hypotheses about that. So as you know, vaccine against COVID-19 protects against these severe symptoms. It protects against the need to be admitted to intensive care, and it protects against deaths as well. So it does not mean that you cannot still have COVID-19 when you are fully vaccinated, but it means that if you become positive for COVID-19, these symptoms are almost not going to be there at all, or going to be very weak symptoms. So there's the measures that the population is fully vaccinated, the more that the rate of vaccination amongst the New Brunswickers is increases. It means that most of the cases are going to be found among people who are doubly vaccinated. But we hope that we will not see the same number of cases that are hospitalized. CGP, you have a follow-up question. I'm just curious to find out. The chief medical officer of the Northwest Territories said last week that there are more and more cases in people that are fully vaccinated, and we might have to think about the administration of a third dose on the Canadian scale soon. So I do not know. Are we at that point here in New Brunswick, or is it too soon to find out what it is about for a third dose? Yes, absolutely. These are discussions that we have every week in our colleagues in other provinces, and as well with the Public Health Service of Canada. So we are ready to launch our campaign for a third dose. But to start off with, really, we're following the directives from the National Committee on Vaccinations. And for that population, those who are admitted in long-term cares homes who were vaccinated in December and January at first, and people who the interval between two doses, time period, there's lesser protection. It's 16, those who only had 28 days between two doses. It's more at risk, but we're starting the third doses this week for seniors. Thank you very much, Mr. Dupuis. Thank you.
Garth, CHCO TV.
Thank you, Bruce. Yesterday's press release mentioned that a person in the 19 and under age group is in hospital being treated for COVID-19. Now, I understand there are privacy issues, but do you have an update on how this person is doing? And are you able to tell us any more information, such as is it the Delta variant and was this person vaccinated?
Hi, Vicky. I unfortunately can't give any updated information around that particular case. All I can say is that it's not very common to have somebody in that age group in hospital. So we'll share information as we can. But the message really is if you, regardless of your vaccination status, we know that you can get COVID-19. We just assume that you'll have a much milder form of it and won't require hospitalization. And we are presuming at this point in time that all cases are Delta.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
Thank you, I do. Of the fully vaccinated people who've contracted COVID-19, especially those who've ended up in hospital, are we recording data about what vaccine they received and when? And also, are you finding any other common threads in general that you've noticed among hospitalized, fully vaccinated people, such as underlying conditions or age group?
We haven't analyzed all of that data yet, but we are collecting it. You are correct. And each province is doing their vaccine efficacy work right now. But in a general sense, based on data from other provinces, the breakthrough cases, again, you can see as the population receives their 2 doses and that percentage of the population increases, most cases will be among people who have 2 vaccines. With respect to those double vaccinated individuals who then require hospitalization, there are many factors that are at play. One, their age, and immunity is affected by age. 2, when they received their vaccination. So, if it's more than 6 months prior to that, and if the interval between the first dose and the second dose is shorter, so that 21 or 28-day period interval increases the risk of immunity waning compared to the 16-week interval. So there are many factors at play, people with immune-compromised conditions, et cetera. So there are other chronic diseases that can decrease your immune system as well.
Both. Andrew Waugh, Brunswick News.
Hi. First, I'd like to get a little bit of clarity on the average length of hospital stays for COVID patients, because we've heard 5 days, we've heard 17 days. And I'd also like to know if the province is tracking readmission rates of COVID-19 patients. I ask because Alberta is seeing a pretty big spike in readmissions.
Hi, Andrew. So for the second question, I haven't seen, based on all the data that have been presented here in New Brunswick, that there have been readmissions for COVID. So that's to answer your second question. The first question, sorry, could you repeat the first question?
I think at one point, and it was you and Minister Shepherd, one of you said the average stay is about 5
yes.
days. And
Yes.
said 17.
Yep.
I just wonder which one it is.
I'm sure we have that data, Andrew. I just don't have it in front of me. So I don't know if Minister Shepherd has it off the top of her head, but we can get it for you.
Okay.
Top of my head.
Your follow-up?
Yeah. This one's for Dr. Russell. Dr. Russell, since the pandemic began, have you disagreed with any of the government's decisions? And if so, what decisions have you disagreed with?
Well, Andrew, as you know, with respect to the process for all policies that are decided upon by Cabinet, all of those discussions are confidential.
Well, we've had other chief medical health officers from different provinces publicly say, I don't agree with what the government's saying here. That's why I'm asking. I don't think your opinion is subject to Cabinet confidentiality.
Well, we can agree to disagree, Andrew, but I won't be breaching Cabinet confidentiality.
Thank
Okay,
you.
so just to be clear, you're refusing to say whether you disagree with any of the government's decisions.
I'm saying that I support Cabinet confidentiality.
Thank you
Okay.
both. Laura Brown, CTV.
Hi there. I know you've already released some modeling on hospitalization, but just in the numbers over the last 24 hours, 7 more hospitalizations and 7 more in the ICU, I believe. I'm wondering, can you describe how bad this is going get for hospitals or the predicted what is predicted for hospitalizations, since you've repeated we really won't see the results of the public health measures for another week or so.
Hi, Laura. I can barely hear you, but I get the gist of your question. It's really around projections for hospitalizations and ICU admissions over the course of the next several weeks, and whether public health measures that are in place currently will be enough to impact the number of cases and hospitalizations. So I'll attempt to answer that, and then if Minister Shepherd wants to add, we can do that. We do work with our epidemiologists quite closely. We meet daily with all of the important stakeholders, including the CEOs of both hospital systems, of both RHAs and Ambulance New Brunswick and EMP. So as of right now, the projections are such that I think we're not able to predict a downturn quite yet. We are waiting for probably another 7 days before we see the cases start to drop, and there'll be a lag time after that, at that time, for when the hospital admissions will start to drop.
I think the only thing I could add to that is that even as early as this morning in a briefing, we talked about knowing that we're probably going to have a 6% increase in cases hospitalized over the next week. So that actually is less than what was predicted, let's say a week ago, at about 13%. And it could have gone as high as 30% without measures being taken. So we're constantly aware of where this is going to go, and the CEOs of Vitalite, Horizon, and EMA and B are in constant communication to manage resources.
Thank you both. Ms. Brown, do you have a follow-up?
Yes, I hope this sounds better.
Yes.
I'll try to speak up. I'm wondering if there was any transfer of patients from one hospital to COVID patients from one hospital to another. I did spot that Upper River Valley is at 115% capacity at this time.
Are you asking if there have been transfers, or would there be transfers? Because the answer is yes, there would be transfers if they were necessary. We definitely try to avoid that. But the hospital, the regional health authorities, again, they're working really closely together to make sure that all the human resources are managed to be able to look after the current admissions right now that are COVID positive.
Thank you. Thank you both. Sarah Deary, Radio-Canada.
So my question is first for Dr. Russell. After the emergency measures that were put in place to wait 1 week before seeing a lowering of number of cases, and now you're talking once again about 1 week for the measures, the short circuit measures. Are this enough? And decisions that were made. I believe that it would encourage us, if we do not see an increase in the number of cases, but it's possible that the number of hospitalizations can still increase, because we're seeing that the time after we see the number of cases increase and the number of active cases now, that it's going to take a couple of days after that we'll be able to see if people need to be hospitalized or not. And as we're increasing the number of vaccinations with the population with 2 doses, that is going to help us as well at the same time. But really, people should really follow the directions of public health, that they must keep the number of closest or lowest number of contacts, wash your hands, physical distance, and the wearing of masks. We have a lot of work to do together in order to decrease the number of cases at the present time, but we need the effort of the entire population. Thank you. Sarah, do you have a follow-up this afternoon? Yes. For the Minister of Health, to find out. The red alert in the health authorities are there because there's a lack of staff. That was the case before the pandemic, and direct consequences in the hospitals. Is there a solution, concrete solution, that's going to be taken under soon? We're waiting for the report by the health reform. We're still waiting for that report. Yeah.
And yes, you're right. Human health resources has certainly been pre-pandemic. However, the Campbellton situation is actually the result of an in-house outbreak. And so the hospital itself has had an outbreak within its facility, and so it has resulted in many of their medical professionals being sent home to have to isolate until they are either cleared or go through the process of being COVID infected and having to work through that. Right now, we have 228 healthcare workers out in the system. And so you can imagine that with a healthcare system who is challenged, not unlike any other province in this country, with human health resources, that puts a burden on all those who are left behind to fill the workloads. I also want to say that, yes, I believe when we table the health plan later this month, you are going to see an urgent action plan to address human health resources and our healthcare system as a whole.
Beaucoup.
Merci.
Merci à vous. Ailish.
Eilish, Bonang, CTV. Merci, Bruce. Ma question est pour l'un ou l'autre. J'ai parlé avec des étudiants pleinement vaccinés qui ont été considérés des contacts près de cas dans leur école et ils me disent qu'ils sentent beaucoup d'anxiété sur le fait qu'ils ne s'attendent pas de s'isoler s'ils sont libres de symptômes et ne peuvent pas participer dans le nouveau programme de tests rapides aux écoles. Et je comprends l'inquiétude de manquer de tests, de kits de tests, comme le ministre Cardy l'a dit l'autre jour. Mais là où les vaccins n'égalent pas une pleine protection, comme vous l'avez indiqué aujourd'hui, serait-il pas censé d'avancer ces cas possibles avec des tests pour tout le monde qui le veut?
So we work really closely with education in terms of formulating our plan for this program. And it's an evolving process because as we roll it out, we do hear feedback like this, but we also continuously look at the risks on a day-to-day basis. So the risks of unvaccinated students versus vaccinated students, the risks of missing cases, as you mentioned, we don't want to miss anyone. So it's taking that all into account and balancing that, but we will continue to work hard to improve whatever needs to be improved in this plan, because we're in constant discussion, again, with education, and the medical officers of health have input regularly on identifying risks and managing those risks.
I could just add to that every single day I am impressed with public health and their team of contact tracers who work through this incredibly difficult process of ensuring that we get as many people as possible and notify them if they've been a close contact. And I can't applaud their work enough. They have worked through every single holiday, Thanksgiving to just recently, and they're doing it because they know that it's one of the best tools we have in controlling the spread of COVID-19. And so as this process unfolds, I think we put faith in public health that they're getting pretty good at doing this work and in knowing how they need to respond to any kind of an outbreak, whether it be a school or a long-term care facility or a nursing home. So we need to put some faith in them that they know what they're doing. And I believe that, we've always balanced this approach in how we put policies in place, and I think that they look at it every single day to see if there needs to be an adjustment.
Follow up.
Yes, thank you. Has there been any contemplation about sending kids under 12 who obviously can't be vaccinated to a learn from home model anytime in the last 2 weeks? And if not, what conditions would be considered critical enough to do so?
I think I'm going to have to defer that question to the Department of EECD just so that you would have clarity in the answer. I'm not aware of those discussions. But it would be really up to Minister Cardy to give you that information for sure.
Thank you.
Thank you.
Tim Roselle, Global TV.
Thank you, Bruce. My first question is for Minister Shepherd, although Dr. Russell can weigh in as well if the suit fits, so to speak. Minister Shepherd, you mentioned that the province is considering expanding the use of rapid tests, and I'm wondering if you can actually expand on your on your note there, and perhaps address in what areas the province is looking to expand and how that expansion may work?
Well, I'm not sure if I could give you proof positive answers, and Dr. Russell may have some information here, but, there have been questions about whether or not we could use them, if we could use them for certain medical appointments, if we can ensure the continuity of services in using them, but they will all be based on supply, and I don't know if Dr. Russell has anything more to say to that.
Yeah, we definitely are having those conversations in terms of how to expand that program. I will say that obviously working with the Chambers of Commerce around the province in terms of the first rollout of these tests has been quite successful. There have been some hiccups along the way that, again, we're working through. One of them happens to be that we are hearing about people who may have access to point of care tests, but don't actually understand how to use them appropriately in terms of when to notify public health if you are positive, and making sure that you do all the things that public health needs you to do if you do have one of the test kits. So I would just caution anybody who does have them that didn't get them through the Chamber of Commerce program. There are certain criteria and pieces of information that are quite critical to be able to use these tests appropriately.
Roselle, do you have a follow-up?
I do, and it's for Dr. Russell, please. Dr. Russell, you had addressed in your remarks the increasing number of COVID-19 positive cases that are in vaccinated people or being discovered in vaccinated people. Are you concerned at all that those rising numbers may dissuade people from getting vaccinated if they're on the fence, or even some people that may have gotten their first dose may not go get their second one because they see numbers like we saw yesterday where it was an almost 50-50 split for new cases of people being vaccinated and unvaccinated. So are you concerned that those increasing numbers among the people who are vaccinated may be a deterrent for people who are considering?
Absolutely, Tim. That's why we're trying to frame the risks and put everything into context with respect to those numbers. So we will definitely see the number of double vaccinated people with COVID-19. We will see those case numbers rise, there's no question. But what we won't see is we won't see a proportional rise in hospitalizations and ICU admission, because the COVID-19 vaccine, when you're doubly vaccinated, protects you about 95% against severe symptoms requiring hospitalization and ICU admission and death.
Both. We'll now go to Savannah Odd, Telegraph Journal.
Hi there, can you hear me?
Yes.
Okay, my question is for Minister Shepherd. About 6 months ago, we heard you hoped to match everyone with a family doctor or nurse practitioner within those 6 months. There are still, of course, a lot of people waiting, about the same as last December, in over 40,000 on that list. So I guess, can you explain why government has missed the mark on this timeline, and how many doctors and nurse practitioners have you been able to recruit over the past 6 months?
So I think that we have a net gain of 23 family physicians in the province in that time frame. But I guess what I'll really zone in on your question is that this has been aggressively pursued by myself and the department, and we've made it part of our contract negotiations with MBMS. They are the union that represents physicians in this province, and so I can tell you that we are extremely close to I believe having a tentative agreement. And I think when that happens in the very short term, I believe that we'll have a model that we can, that not only MBMS, but government and myself can be very proud to deliver to the people of New Brunswick.
Ms. Odd, do you have a follow-up?
I do, thank you, Bruce. You mentioned the health plan being tabled later this month. Your department had referenced in a statement to me, an innovative solution that will connect all patients waiting for a primary care provider to get timely access. Should people expect, I guess, that they will have access to a primary care provider by the end of the month? Is that part of the plan?
I think that we're working through this, and certainly I believe that it's not only part of the plan, but as I've mentioned, it's part of the negotiation process with MBMS, and we've been in very aggressive negotiations with them on both sides. They've been very willing to have this conversation, and I'm very grateful for that. And then we have some logistics to work out. I can't say that everyone at the end of this month is going to have access to a primary care provider, but it's not going to be long after. And we will be unrolling that information as quickly as we can. But I'm anxious to get it out there as well. And I know every New Brunswicker who doesn't have a primary care provider is anxious for it as well.
Thank you, Minister. Thank you, Ms. Odd. Before we move to the next question, Dr. Russell would like to make an additional point to Tim Roselle's question.
Yes, just coming back to the rapid tests. So those people who do test positive with one of the rapid tests, you need to book an appointment to get a PCR confirmatory test.
Thank you. We're going to move to Bobby Jean McKinnon, CBC.
Yes, thank you. Can you hear me okay?
Yes.
Okay, thank you. Minister Shepherd, Green Party health critic Megan Mitten has called for an independent investigation into the COVID outbreak at Drew Nursing Home in Sackville, and for the government to be more transparent about outbreaks at other facilities. How do you respond?
Well, it's not unlike opposition to call for independent investigations into pretty much anything, and I'm not downplaying the significance of the Drew outbreak. It has been a difficult time in that facility. I'm not quite sure what questions she's looking to have answered, but I'd be more than happy to take questions under advisement and give as much information as we can, along with protecting privacy of individuals associated with that. But we haven't been shy to certainly evaluate every single outbreak in every single long-term facility that we have. Public health helps us with that. EMA and B and the prompt teams are extremely adept in working through the challenges that they present. And we're very transparent. So I guess if they can't get answers to their questions, we could take it under advisement, but I'm not sure of any questions that they would ask that we wouldn't answer.
Ms. McKinnon, do you have a follow-up?
Yes, thank you. For Dr. Russell, you've been saying that New Brunswick youth who are getting infected aren't getting very sick, but we do now have someone under 19 hospitalized, and we've seen the devastating numbers coming out of the state. So what is your message now?
Well, it hasn't really changed, honestly. Because of confidentiality reasons, I can't really frame the situation with respect to the person under 19 who's admitted to hospital. But what I can say is the data is still the same as what we've been speaking to around cases in children tend to be milder, cases in children tend to be short-lived, and they still are transmitting. So that is the biggest risk right now to the population is children at risk of transmitting to either elderly people, grandparents, immune-compromised people, etc.
Thank you both. Thank you, Ms. McKinnon. We're now going to go. On va procéder avec.
We'll proceed with Derek Dubé, TVA. Yes, can you hear me? Yes, Derek. Hello? Yes? Okay. So my question is for Dr. Russell. We know that the Acadie-Bathurst region has relatively been saved during the pandemic, but now we see COVID-19 cases are getting higher and higher. So people are starting to get worried. Can we be concerned or worried because we had 50 active cases during the weekend in Region 6? Yes, it is worrisome. It's always worrisome when we see the number of cases increase, but it's more worrisome when we see there's a number of people who are hospitalized. And when we see the number of people hospitalized is in the increase, that is worrisome, and more particularly people who are not unvaccinated. So for the time being, our advice is to get vaccinated as soon as possible with both doses, and as well to avoid meetings and keep your close contacts to the lowest number possible, and to continue to follow all the other guidelines from public health. So to reassure you, there are things that people can do in order to deal with these concerns. Thank you. Monsieur Dubé? You have a follow-up question this afternoon. Yes, in Region 5 mainly, in the Campbellton region, we've known that most of the 40 years and lower are still not fully vaccinated, under 40. So is that a problem? We know that the Campbellton Hospital is an eruption inside, a breakthrough inside. It can be problematic if they're not vaccinated enough. Do you have the exact figures for people who would not be vaccinated in those lower than 40 years of age? I do not have the percentage of people who are vaccinated amongst the age in each region, but I know that the population in general in those from 20 till 50 around the province, there are places where the vaccination rates are lower than others. So the message is the same. Get vaccinated as soon as possible in order to protect not only yourself, but those who are close to you and who might need to get hospitalized for other illnesses, not only COVID. Thank you, Mr. Dubé. Thank you.
Mia Urquhart, CBC.
Thank you. How many cases are coming from church exposures, and are you considering any additional restrictions on religious gatherings?
I don't think we can be specific about which, how many cases are attributed to, specifically church gatherings. But what I can say is that we do know that there was a significant number in the month of September that came from church gatherings, and this could be true of really any gathering. So that's why we've really focused on that. We did provide a policy by which churches could continue to operate. And I'm grateful to the faith-based leaders who have not only helped us with that policy, put it together to make sure that they could operate safely, but that their parishioners remain safe, and thus the community remains safe. So I don't have specific numbers related to church gatherings here, but we do know that in September there was a significant number that was a part of the outbreak.
Thank you, Minister. Ms. Urquhart, do you have a follow-up?
I do. New Brunswick has been providing a breakdown of new cases and hospitalizations by vaccination status, but you still haven't followed the lead of other provinces like Nova Scotia in providing the vaccination status for deaths. Why is that?
I am not sure. I guess I will have to ask our epidemiological team and our team with public health and have that discussion.
If you have them, can you give them to us now?
I do not have them.
Thank you, Ms. Urquhart. Thank you, Minister. Thank you, Doctor. Thank you, members of the media and everyone for joining us for today's update. Merci aux membres de médias.
Thank you to media and everybody for joining us today. So that's the end of our update. Thank you very much.
Today's update. Thank you.